So the question is, why does my pigmentation keep coming back after doing so many lasers elsewhere?
As Dr. Chua.
Yeah, come in.
Hello, doctor.
Hello. Come in, please.
Many people ask about one question. Why does my pigmentation keep coming back?
Oh, okay.
Here's your mic.
Okay. So the question is, why does my pigmentation keep coming back after doing so many lasers elsewhere? Okay, so I've got this question a lot of times, and it's a very common question that I've received from customers, from patients. A lot of times you have to understand that not all pigmentations are the same. Okay, many people think that pigmentations are like pencil spots. They can basically just erase away using a laser and then the pigmentation goes away permanently, but it doesn't behave that way. There are many different diagnoses such as melasma, freckles, sunspot, lentiginous. All of them will require different treatment and different settings. Let's say for example, if somebody comes in with a melasma, then I have to be very careful on treating the different layers and the causes of the melasma instead of just going with the laser alone. Often I will actually recommend using combination of topical therapies together with the laser treatment. Sometimes I have customer coming in, they have heard from the friends have done laser A, they come in understanding that they need a laser A in order to have a good result. But after the assessment, I recommend laser B, and turns out the customer had good results after that. So a lot of times, what I think is that we need to understand the diagnosis, and assessment is very important. We don't sell treatment before we understand what the problem of the skin is.
Oh, so you need to diagnose the patient first?
Definitely, it's very important. Diagnosis is the first step to giving good results to the patients.
Then does this mean that the laser doesn't work?
Now, different pigments require different kinds of laser in order for it to have a good result. And sometimes it may not just be a laser treatment alone that is needed. Sometimes you need combination together with other topical therapies and treatments in order for the best result to be achieved.
So when a patient walks in, right, you are not already thinking what you're going to sell them this laser?
Oh, we don't work that way. And the important thing is that treatment only comes after I've assessed the skin and after I understand what the skin problem is, and that is how we can devise a plan in order to help the patient.
That's very interesting. Okay. I also want to add something more controversial. There are clinics that push packages really very hard, but you don't seem doing like this way. Why?
The reason is because I believe that trust is most important, and allow patients and my customers to have time to think about it, to see what the results are, and then decide on whether or not to proceed with the treatment rather than to pressure them with the sales.
But your business, how? You will not lose your business?
I believe that trust goes a longer way rather than a pressure sales.
Okay, if someone who has difficulties to remove pigmentation long time is watching this video, what's the biggest mistake they should avoid?
Biggest mistake is to go under the sun often while receiving the laser treatment. That's the biggest mistake, right?
Any other thing they should be careful?
Not having a right diagnosis before starting the treatment. So having the right diagnosis and assessment is so important because that determines on what kind of treatment you get and what kind of good results you can get.
It's my personal question. Does the sunscreen can remove the pigmentation?
Sunscreen is a prevention, it's a maintenance. So sunscreen does not remove pigmentation, but after a while of a sun protection, certain pigmentations can actually lighten because of the avoidance to the sun.
I usually work in the office, so I hardly see the sun, but I still have a pigmentation. Why?
Okay, so pigmentations, or rather the skin tells the truth after many years. So even though these few years you have not been working under the sun, but the sun damage can be accumulated over the many years. And also at the same time, genetic plays a large role. So you can have people who are more prone to forming pigmentations easier than other people. Hormonal factors also, for ladies tend to get certain kinds of pigmentation easier than the male.
That's very interesting. Really last question from me. Does the pigmentation cream can replace the laser?
For pigmentation cream, they work on the surface of the skin. They don't go deep enough and they don't have the intensity of the laser. So definitely for many kinds of the skin condition, you will need to combine some creams together with the lasers.
Do you have any word for those people who want to remove the pigmentation?
So visit a doctor to understand more about your skin. Can be anyone, but most importantly, the person must have the right diagnosis for you.
Thank you, doctor.